Okay, we have time for a few questions here. Thank you. All right, thank you both for a very insightful overview of the beverage-related guidelines. I think I'll lead with the first question as the other ones are coming up here. Thank you. So as you both have spoken about, you've both been involved in a wide variety of guideline development projects. I was wondering if you could just share some further thoughts on the strengths and perhaps some of the limitations of other groups and organizations and committees that are kind of working along the same lines.
I'll just say that the development of these the applications of evidence is not a simple thing to do and requires substantial time and effort, and if you're doing a formal evidence review, that actually is several orders of magnitude greater. I think that there are various groups who do this, and when they come to the same conclusions, it's a good thing. It doesn't always happen because I think there are major gaps in evidence that require interpretation and sometimes insertion of expert opinion. And but ultimately, I see this as a process of refinement, and each organization has a certain audience that it's working towards, and I think in the development of guidelines keeps that in mind.
So I want to share two very different experiences I had. So the first one is that I have served twice with the Dietary Guidelines Advisory Committee. As probably most of you know, it is divided into 3 steps or sections. So the first one is the Dietary Guidelines Advisory Committee report, which is really very, very systematic, very evidence-based, very much bias-free, as much as human beings can be unbiased, and very strongly based on the consensus from experts in the field. The second phase involves the translation of the scientific document into the policy document, which is the one we refer to as the Dietary Guidelines for Americans. And the third stage involves the development of the policies, dissemination materials that different programs can use. And also, for example, the relationship of the guidelines with the food label that the FDA has to adhere to. The main experience I've had the 2 times is that compared to the first stage, which is very scientific based, very transparent, very free of bias, the second stage, in particular, the development of the policy report, is not very transparent, and it is subject to enormous political and lobbying pressures. And this time around, it was very, very clear, the coalition that got formed among lobbyists and legislators to try to get their way in terms of dictating to a scientific committee how and what the interpretation of our recommendations should be. So I think that in terms of that process, it would really be important to figure out how to establish a very firm firewall throughout the process, so that it can also be transparent, it can also be evidence-based, and it can also have input from all stakeholders, including low-income communities, as to how these documents get translated into enactable policies. The second fantastic experience that I just had, that I was very well trained for through the Dietary Guidelines Advisory Committee experiences, is that I was privileged to have been asked by the Healthy Eating Research Robert Wood Johnson Foundation initiative at Duke to chair the national panel to develop what I think are the first set of comprehensive, responsive parenting, infant feeding, toddler guidelines. And several of the members of that panel are in this room. That process was very, very evidence-based. Obviously, it was more focused in an age group, in a particular topic, although it was also huge. But I would say that the committee not only had input in the scientific report, but has had input on the translation of that scientific report into what would be the equivalent of the policy document, and now on the translation of that policy document into specific guidelines for the WIC program, early childhood education centers, and so on. So I would say that the dietary guidelines process has been very reluctant to get into policy recommendations. But I would argue that if they don't follow more the model that HER has established, they will become less and less relevant, because we have a ton of scientific knowledge, of evidence of how different age groups should be, the type of foods they should consume. What we lack is really the implementation science research, and this policy research is happening right and left. So I hope that the DGAC process, the Dietary Guidelines Advisory process, learns a lot from the wonderful job that the Robert Wood Johnson Foundation is doing through their guidelines committees.
Yeah, I would just like to also emphasize the implementation part of this. We know that even the best evidence-based guidelines are not implemented in practice or take a substantial amount of time, even sometimes 10 years or longer, to be implemented. And so we need more understanding about how to help pediatricians, as an example, implement the AAP guidelines. And we heard this morning about the gap between what the guidelines say should be happening and what's actually happening in children's diets. So we have work to do there, I think.
Okay, we have quite a bit of questions here. See how many we can get through in the remaining minutes. So one question is about the National School Lunch and Breakfast programs, which allow for up to 50% of fruit requirements to be satisfied by juices. Given the earlier discussion about juices, should requirements be changed to only allow for whole fruit?
Well, so I think it's this may be another example of perfect being the enemy of good. I think that there is a role for 100% fruit juice in helping to meet the fruit requirement. And as mentioned, it's not perfect because it does not include the same fiber and some other elements that you get in whole fruit. On the other hand, 100% fruit juice has some elements that might be helpful in terms of portability, ability to store it, shelf life, et cetera. So I think we should have a discussion about what the right combination might be, but I don't think it would be a wise idea to eliminate 100% fruit juice altogether.
Yeah, so I think that we would be better positioned to deal with this issue if we had a life course strategy in place. As Leanne Birch mentioned earlier on, the kids develop their preferences starting very, very early on in life. You know, the flavors of the food that mom eats gets transmitted through the amniotic fluid to the fetus. So it is really, really important that we don't train the children, infants and toddlers, to consume those sweet foods and beverages, because then it will happen what Steve is saying, that when they arrive to preschool or kindergarten or elementary school, if that's how they were trained, if that's how their favorite preferences were developed, it would be very difficult to take away those fruit juices. But if we have a strategy in place that is life course, essentially those kids are not even going to demand perhaps not even the fruit juice. So, but we need to think across the life course when it comes to policies and what will allow a much healthier school lunch program to be successful.
Just to add, it may also be important to think about what Rafael discussed related to food, not talking about individual foods, but really talking about dietary patterns and the role of different foods, including 100% fruit juice, in those dietary patterns.
So this is for Dr. Daniels. Can you talk about how and when the AAP has changed their recommendations of juice over time?
Well, probably the biggest example is in the most recent juice statement. The recommendation was not to introduce 100% juice until after 1 year of life, whereas before the recommendation was that fruit juice could be implemented at 6 months of age. On the other hand, I think the portion size recommendations have been pretty consistent, and I think are based on reasonable thoughts about balance of nutrients and calories.
Okay, this one's for Raphael. What do you feel would be the best way to control SSB purchases on SNAP?
What I can say is what my panel advised to the Undersecretary of Agriculture a few years ago when we were asked if we should consider, or USDA should consider, earmarking more the foods. It's almost to make SNAP like weak, or to actually focus more on providing incentives and really a discount or additional funds for those who purchase fresh fruits and vegetables. And at the time, there was a lot of pushback from essentially civil society organizations that were with very low-income communities that felt it would be extremely unacceptable for them for the programs to target their the communities they represented, specifically disallowing them to do this or to do that. And there was some evidence that providing the discounts or the vouchers, additional vouchers for fruits and vegetables may have a chance. So that recommendation we made was to actually launch the HIP trials, a healthy initiative program that several of those RCTs, my understanding is, have now been completed. I mean, the only way I could see how SNAP could perhaps do it is if they come up with a new definition of what a food is. And essentially, I think under that definition, sugar-sweetened beverages probably wouldn't make the cut, and that would be a way to prevent the use of SNAP benefits to purchase sugar-sweetened beverages.
Thank you.
I would just add that it was mentioned earlier this morning that SNAP has a very important education component to the program, and I think that may be another area we should think about how to utilize that as a way of promoting better and better nutrition.
So I'm going to ask these three questions kind of together because it's in the area of talking about milk. Okay, so the first one is about the AAP indicated that milk should be the main drink for kids aged 1 to 5 years. Does that mean that the recommended alternative to SSB should be milk for young children, for instance, rather than water? Hold that thought. Also, is the comparison that you made, this is Dr. Daniels, with flavored milk improving milk consumption, have whole milk as the alternative option? Would a better policy be providing whole milk as the option and drop the flavored milk? And then the final one to this milk is with regards to infant formula, doesn't it include a significant amount of sugar? Just because we have 3 minutes left, so.
So 1 minute for each question.
Yes.
Well, so let me see if I can remember them. But starting with the last one, breast milk also obviously contains sugar. The goal of formula is to create something that comes as close to breast milk as possible, and does not include the kinds of protein load and other things that create the setup for iron deficiency that you see with whole milk, or cow's milk, which is the reason not to use cow's milk in the first year of life. The question about flavored milk versus whole milk, I think is really it really is a flavored versus unflavored. The results of the studies really basically showed that kids who were drinking flavored milk, when it was taken away and replaced with unflavored milk, reduced their consumption of milk. And the thought was, well, that's just temporary. It will bounce back after a period of time, but unfortunately it did not. And so it meant that milk was being replaced with other beverages, and that I think is problematic. The first question had to do, I guess, with the balance of different beverages during childhood. And I think from an AAP perspective, we would see this as kind of a hierarchy. So I think milk should be the main beverage for children. And if they're not drinking milk, I think water would be probably the next choice. As we talked about, I'm leaving fruit juice out of that discussion because that really should be a discussion about portion size and in relationship to other opportunities for eating fruit.
Oh, we have time for maybe one more. Oh, go ahead, sure.
Because I think that what is very interesting is that really the most important difference when it comes to childhood obesity risk between formula and breast milk is more the protein intake. The protein levels are much higher in infant formula for a number of reasons, and that is what has been linked with higher insulin levels and higher risk of obesity. There are RCTs now had been conducted by Bert Kolesko and colleagues in Bavaria, and there is something going on with protein. I agree that breast milk is very sweet, and that's not perhaps the main difference.
Well, and there may be other differences between bottle feeding with a formula and breastfeeding in terms of hunger and satiety cues and other interactive things between the infant and the mother.
Okay, so I'd like to thank both of our speakers for their outstanding presentations and insights and perspective. So let's give them a round of applause.